Good evening and welcome to Arizona Horizon. I'm Ted Simons. The U.S. government officially shut down overnight, with Democrats holding firm to their demands to salvage health care subsidies that President Trump and Republicans in Congress have refused to negotiate. Indeed, the White House continues to threaten a mass layoff of federal workers in a matter of days should the shutdown drag on. All of this impacts a variety of government-funded agencies in a variety of ways, but what about Social Security and Medicare? Joining us now is Dana Marie Kennedy. She's the director of AARP Arizona. Good to see you again. Thanks for joining us.
Thank you so much for having me.
Yeah, okay, let's start with Social Security. How much is this affecting Social Security as we speak?
It shouldn't affect it at all.
Wow.
So you should still get your Social Security checks, unless it goes on for over 3 months. But right now, we believe that everybody should be getting their Social Security checks.
So these are monthly checks, correct?
Monthly checks, correct.
Okay, and because the Social Security, I believe this was all approved by Congress, the funding was approved by Congress. Is there an expiration date on that?
An expiration date?
I don't think there's an expiration date on the funding for this additional funding or continued funding for Social Security.
Correct. We've been working really hard to get the continued funding for all the Social Security offices, especially the people who answer the phones and the customer service agents.
Well, but then in looking into this, I read that maybe some Social Security agencies or services, I should say, could be shut down, maybe providing customer service and these sorts of things. Is that what you're hearing?
We're concerned about the customer service part.
Yeah.
Each agency gets to determine, put together a plan. We haven't seen the plan per se. But as far as people receiving their checks, they're still going to get their checks.
Things like benefits verifications and earning records updates and all that minutia, that could be affected?
There could be some delays there.
Yeah.
For sure.
Replacing Medicare cards, things like that, could that, by way of Social Security, I want to get to Medicare in a second, but replacing those cards, could that be affected?
That could be delayed.
Yeah.
So there's a lot that we don't know, but what we do know for sure is what people are most concerned about is making sure that they're still getting their direct deposits.
Yeah, because it sounds like the Social Security Administration does have contingency plans for shutdowns. We've been down this road before.
We have, and people still get their checks.
Yeah. Cost of living adjustment, though, is that going to be delayed? What's going on with that?
I don't believe that will be delayed, but it could be. There's still a lot that we unfortunately, just shut down, so we still don't know everything.
And those cost of living adjustments, that happens this time of year, doesn't it?
It does. And so they may not roll that out because that will take workers to be able to do that.
Yeah. Regarding Social Security, again, I want to get to Medicare in a second, but Social Security, what are you hearing? What are people, besides the check? Obviously, the checks are the big thing. Is that pretty much the majority?
Well, unfortunately, this just happened the same time where they were stopping receiving checks. So people who received a paper check, that actually stopped just on the 30th. But most people already have direct deposit.
Yeah.
So people who needed to be able to transfer to get a direct deposit account, they needed to do that. So paper checks have been eliminated unless you are 90 and over, or you have some type of mental impairment. So people who all of a sudden may be concerned about that, they may have a hard time getting through the Social Security Administration.
Interesting. I didn't even know that I didn't even know that they no longer sent out checks.
Well, only about 7,000 people in Arizona still were getting checks.
Yeah.
But if you think about rural Arizona, some people may not have access to banking, so some people were still receiving checks. So they stopped that on the 30th.
All right, that's Social Security. Sounds like things are pretty much okay for now, just watching and waiting. Mm-hmm. What about Medicare?
Medicare is going to be fine as well. However, if you're just applying for Medicare, there may be a delay, and there may be delay in getting your Medicare card. But that means you're still eligible to receive health care benefits under Medicare.
So when we talk about the enrollment period, this always confuses me with this. When is the enrollment period? For how long? Who qualifies? And is that affected by this?
So Medicare enrollment period is October 15th. So I'm a little concerned about that open enrollment because a lot of times people have questions and they want to be able to contact Medicare. Caseworkers, that may be impacted by this. They may be furloughed. So people, if they had a Medicare caseworker, they may have a hard time being able to get in touch with that person. But Medicare itself, as far as the benefits, that should be fine, but payments could be delayed.
I was going to ask about payments.
Yeah, so payments to your doctors or to hospitals, those payments could be delayed because of the shutdown.
All right, but that is something that has to be dealt with by the doctors and the hospitals, correct?
Right. And the insurance, right?
Right.
Which Medicare is your insurance.
So basically,
insurance.
you do your part, but it's the providers that are going to have to figure out what's going on.
There could be delays in getting their
Yeah,
payments.
yeah. The longer the delay, the more the disruptions, I would imagine?
Absolutely, absolutely. Hopefully it's, the delay isn't more than a couple of weeks.
Do we?
Or, I mean, the shutdown.
The shutdown, yeah. Well, we'll see. They don't seem to be in any big hurry to get this done. Do we know anything about SNAP benefits and these sorts of things? How's that holding up?
So once the money runs out, then there's going to be delays with SNAP benefits as well. So people who need food assistance, that could be impacted as well.
And how many Arizonans are on food stamps?
I don't know off the top of my head.
But it's quite a few, and they need.
Yes.
Do you think people realize when they hear the government shutdown? It almost sounds like it's happening way over there. It's not going to affect us too much. Just make sure the checks come and this, that, and the other. But if the SNAP and food stamps by any other name here, that's affected. That's going to affect a lot of folks.
People who have food insecurity, absolutely. And people, running all the food pantries as well.
Yeah.
That's also money into the economy.
And all of this obviously affects seniors. Talk to us about that and just how concerned you are. I mean, how concerned you're hearing, what kind of concern, I should say, you're hearing from seniors?
Today, our phones haven't been ringing off the hook, but we have been getting some emails regarding some questions that people have. And they do want to know, mostly they're concerned about, any type of payment that they're getting.
Yeah.
But they are concerned about the open enrollment as well. And so I think that seniors, and also I'm concerned about the home and community-based services that are provided by the area agencies on aging. All those payments could be delayed. And they're already short of funding as it is.
Yeah.
And they have large caseloads.
So bottom line here, Medicare and Medicaid benefits, good for now. Social Security payments, including SSI benefits, good for now. VA medical care and benefits,
Good for now.
Good for now. Some regional offices might be closing though, huh?
Yeah, but the medical offices are okay.
And disability payments, again, good for now.
Yes.
And SNAP benefits, good for now, but that one, the longer the shutdown, the more
Yeah.
disruptions will follow.
Yeah, and also just qualifying for these programs and the questions that people ask.
All right. Well, you're going to have a lot of, I'm imagining your phone's going to start ringing a little bit more as the days wear on. Dana Marie Kennedy, AARP Arizona. Good to see you.
Thank you for having me.